Hello, everyone. Thank you for joining us in our podcast, Your First Sense. And I'm super excited today have our guest who is not just my friend, but is also very highly accomplished medical doctor and surgeon, and truly multifaceted individual. But before you meet him, I would like to share the bio. I must say, we are just scratching the surface here because there's so many incredible things he had achieved in his very short life. So here's the bio. A board certified plastic surgeon, an artist, and a medical missionary, Dr. Lee looks at his work through a different lens. His practice is all encompassing, including skincare and whole body care, integrating his surgical with the non surgical. Dr. Lee believes in holistic approach to care. It goes beyond the surgical procedures to include skincare, fitness, and nutrition, all with the goal of helping his patients to feel more confident about themselves. Dr. Lee believes this is a commitment for life. And that is why he calls his patients a partners. This is the philosophy that he believes that everyone should feel confident and beautiful physically, mentally, inside and out. Dr. Lee also assisted the poor and needy in reconstructive surgeries in India in the late 1990s. And he has been very fortunate to meet even the beautiful Mother Teresa in her home, Calcutta. And when I was kind of dabbing into all the big, huge list of things, I just picked a few things that kind of jumped on me. Beyond just the medical, Dr. Lee had been dabbing into the nutrition and wellness and became certified in health optimization. He studied essential oils extensively. I would say he's one of the experts in this field. And he had dabbled and mastered the energy field of Reiki and many, many, many things. He had talked on very interesting topics from health and nutrition and state of mind and food and disease and my favorite topic, which I have not heard, is about the health benefits of chocolate. So many things, like I said, multifaceted. I'm so excited to have you and where we can start, because there's just so many things we can talk about.
Lenka, thank you for that introduction. I have been blessed with so many opportunities, and that's all these things are because I love to learn. I just want to know more.
Yes.
And that's how this whole journey came about. And so you were very instrumental in the latter part of this, and with the energy healing and opening my eyes to other ways outside of traditional allopathic Western medicine, and help me see myself, see people, see our existence, and see life in a much different light.
Yes, I still think that when I met you and heard your story, which I really would like people to hear, it would pop in my mind when you were sharing that is the movie
Dr. Strange.
Doctor Strange.
You sent that to me, yes.
Yes. So share with us in kind of like these bullet points, because it is a very, like, it's a journey, like you said, it's a journey that it took many years, but like your background and your family, like they all like based in that allopathic medicine, right?
Yes, yes. My entire family is or are, for the most part, physicians, including aunts, uncles, and cousins. My dad's an orthopedic surgeon, and my mom was a nurse. And so we grew up in this Western allopathic medical mantra, if you will. And I went through all my training, high school, college, medical school, and then 5 years of general surgery and 2 more years of plastic surgery, and had a wonderful practice here in Indiana. But I started having some issues with my hands, some swelling of my joints, and it ended up being psoriatic arthritis. Well, being trained the way I was, I thought I knew what to do, but I wanted to make sure. So I sought the consultation of a friend of mine who's an orthopedic hand surgeon. And we did what we were both taught and what we thought was best to do, and that was starting prescription strength anti-inflammatories. It was wonderful. for about 6 months,
Yeah.
but I didn't change anything else. I just took the medication and my hands started to get achy and stiff again. I was not able to hold the instruments the way I was trained in surgery. And so, like any good physician, I double dosed on it uh, and got gastritis. So we're not as smart as we think we are. Um, but I went back to see my friend, and he was incredulous on how inflamed my knuckles were. They were about twice normal size. So he started to inject steroids directly into my knuckles and did that 3 times over a year and a half. It was the same thing with the oral medication. Worked great at the beginning, several months. Second time he did that, only a couple months. Third time, only a couple weeks. And it was progressing so rapidly that I was within about 9 to 12 months of losing my surgical career.
Mm.
So I ended up taking extra specialty specific disability insurance. So if I couldn't operate, my disability carrier couldn't say, well, you can go work at the local Doc in a Box on the corner. Um, and that very week I did that, I ran into an acquaintance who told me about this botanical source. And it ended up being Moringa oleifera. And when she's told me what it all had with no side effects, it's like, I'm going to give that a try. So within 4 weeks, my hands felt better. Within 4 months of daily consumption, I was off all medications and my hands are back to normal. This opened my eyes to say, wait a minute, there's something else going on here that I wasn't trained in medical school.
Mhm.
And it was
Wow.
purely nutrition. What I ended up doing was feeding my body and giving it the nutrients it needed, but also decreasing the inflammation, and my body began to heal itself. Fast forward another year or two, and this company that I was getting my Moringa came out with an essential oil line,
Mhm.
and same thing. I prejudged it from my limited medical background and said, how can you put something on the bottom of your foot or smell it or rub it on your temples? Your headache gets better or your stress goes down. And it was my ignorance and my assumptions. So my curious mind ended up saying, I need to learn more. So I ended up getting 3 different essential oil certifications. One of them took 2 years in a research paper.
Mhm.
And curiously enough, I wrote that research paper on how we can use essential oils in an ambulatory outpatient surgery center to help reduce
Wow.
the medications and things like that. The journey
That-
continued with
Mhm.
health optimization coaching and all these other things just for the physical wellness of the body. My parents had a place in Bonita Springs, just north of you. And you actually, my mom was seeing you for some of her health issues. And when I went down to check on them, I think it was a January or February. It was cold in Indiana and it was warm and sunny in Florida. So I made the trip down to check on my parents for a 3-day weekend and was telling mom my back was sore, but I had all these kind of weird thoughts or ideas that kept popping into my head and about atoms and they vibrate. Everything's made of atoms, but this table's not vibrating, at least not that I can sense.
Yeah.
And I didn't know I was kind of thinking about quantum physics. I kind of was averse to physics because I had to take the MedCat in college to get into medical school, and physics is 1/6 of the test. I had not taken one day of physics before taking that test. So yeah, definitely PTSD there.
Yeah.
So, and that's my mom says, Brian, you need to meet Lenka. And it's like, okay. And later that afternoon, I'm at your office and you just kind of nonchalant said, so what's going on? And talked about my back hurting. I actually broke my back when I was 13 playing hockey.
Mhm.
So bending over in surgery, different positions exacerbate that. So we kind of talked a little bit about that. And I don't know if mom clued you in or just your intuology said, no, there's something else here. So we started talking about that. You said, great. Would you like a massage or would you like energy healing? And it's like, I never heard of energy healing. And I said, let's give it a try, knowing that a physical massage helps the aches and pains for a day or two. And ended up, you did a Reiki session, you put the relax mate glasses on, some nice binaural beats to synchronize my left and right hemisphere of my brain, beautiful aromatherapy, and what I assume were some crystals kind of down my chest and things, and did a Reiki session. And I never knew what that was. And I felt the heat coming from your hands, even though they were, I don't know, 2, 3, 6 inches away. And just this state of calm bliss, and just laid there and just absorbed it. Um, After we were done, I got up, and not only was my back pain gone, I just had this inner peace and this overwhelming feeling that everything's fine and
Mm,
everything will be fine.
mm,
So thanked you, went home, spent the rest of the weekend with my parents, flew back to Indiana, did surgery, really busy week that week. On Friday afternoon, I'm thinking, wait a minute, I still feel great and my back doesn't hurt. So I texted you and said, I don't know what's happening, but I still feel great. And your response was, great, hold on to it as long as you can. And I'm like, what the heck does that mean? And you said, just hold on to the feeling. Just keep that, embrace it. And so I did. And then found out about 2 months later, you were giving and teaching level 1 and level 2 Reiki on a weekend. My parents were still down in Florida, so I'm like, I'm going down. I need to learn more about this. So did that first weekend of Reiki, and started to learn how powerful we really are and how much control we have. And that's what I find in kind of our Western medical model is, as individuals, we surrender that power to somebody else to tell us what they think is best for us. Yet it's only based on the three-dimensional physical body and neglects all the other aspects of which we really are. So did that, and then 6 months later went back and did the level 3 master class, and just started practicing that. Actually was doing it on my patients in surgery without them really knowing. As the surgery started, we have what's called a surgical timeout, where everybody stops what they're doing, and we say the patient's name, birth date, allergies, what procedure we're going to do, if it's left side, right side, both sides. So everybody in the operating room is on the same page. As we're doing that, I have my hands cupped over their heart, just
mm,
sending that loving, healing energy.
mm.
Um, and things started to change. I would notice things. Plants in our house started growing wildly, and all these kind of, what I now know is just that energetic, loving response, but uh, I couldn't quantify it or explain it before.
Yeah.
And then I was very humbled. About a year later, you asked me to come down and teach Reiki with you. And that kind of started us going back and forth between Naples and Fort Wayne, Indiana,
Mhm.
to start to educate others on the energy healing, and kind of this, taking that source of energy, channeling it through our bodies, and then transmuting that and sharing that with others.
Yeah.
So that is kind of my journey from way off doing surgeries to now looking to really help people on a deeper level.
Mm,
And one of the things that kind of spurred that, somebody asked me years ago, as I started to transition more from late night traumas and dog bites to the face and facial fractures from car wrecks, and said, Brian, how can you justify doing cosmetic surgery versus only reconstructive? And I struggled with that question for a while, but then it hit me one day, and when what I noticed that what we do in both of those realms is we change the external physical appearance of the person. Some have abnormalities, some it's just the aging. But when we change that appearance, we also change then the way they view themselves and the way they feel about themselves. And that positive self-improvement goes through their body, and then their life changes, and every relationship that they have changes. And and that's when it hit for me. It's more than just the body. We are affecting the mind, and the emotions, and that then translate to the rest of the world.
Wow, like quite the story. So if I go back, and thank you for sharing this because it is pretty incredible. If we go back into the beginning and just something so miraculous as moringa, there's a lot of people still don't know about this amazing plant. Can you just tell us, because I have to say my story. You're actually, your mom was knocking on my door with this moringa, and I was so stubborn because, there's so many products out there, and I'm like, yeah, sure, okay, great. And she's like, you need to try it, you need to try it, you need to try it. It took me probably a couple of years finally to give in. But now I have to say I am so crazy about moringa. I have 2 trees in my backyard. I am religiously eating this daily, and I am so grateful because you have introduced me to moringa. So I just don't go just by some powder. I have the whole trees. So anyway, so tell us about this amazing,
Yeah,
amazing miracle plant.
it's curious. Moringa has been on Earth for over 4,000 years. It's thought to be referenced in the Bible, where at Mara, when the Israelites were wandering the desert, Moses threw a stick in the water and it purified the water. Well, we know that the seeds of the moringa plant put in water in third world countries and mixed around for a few minutes purifies the water. It's the most nutrient dense plant ever discovered. The NIH, our own National Institute of Health, researched this for over a year in 2008, which was the time that I was having a lot of my inflammatory issues. And what they determined, and this is the NIH's saying, not mine, is that moringa can cure, reverse, or mitigate over 330 disease processes. If I say that, I'm claiming it's a drug. It's not. It's a God-given plant that he put on the earth that has all the vitamins, nutrients, amino acids, antioxidants, anti-inflammatories that the human body needs on a physical level to function.
Mhm.
And I was blessed that a friend of a friend said, here, Brian, try this, because I was running out of options.
Yes, it's absolutely incredible that that plant not just gave you nutrients, it gave you shift in consciousness. If you think about it, it literally shifted everything in you by just this, like you said, God's given medicine that we have ability to get hands on and has this anti-inflammatory properties, like incredible. And so you, in the end of our show, you can tell us about, how we can find this moringa
Okay.
potentially that you're using. And then you were talking about essential oils. Essential oils is becoming like really hype and also a very confusing aspect. So can you kind of tell us a little bit about, because you did so much research, like you can go to grocery store now and find essential oil. Is it something that you would put on your body?
I would be careful which brands of essential
Mhm.
oils that you would use. To me, essential oils are God's medicine that he put in plants. And if you look at the plant, it kind of gives you an idea of what that essential oil is going to do. So if you look at the lavender fields in France, and it's just so calming, and that's what lavender does.
Mhm.
Tea tree is very, or melaleuca is very cleansing. And when you know that the melaleuca tree grows in a swamp, that the tree has to absorb that putrid water, but it's the
Mm-hmm.
essential oil that purifies the water so the tree doesn't die.
Mm-hmm. Mm-hmm.
But there are quite a few brands out there that have very good reputations, and just a quick internet search, you can start to see. But I use essential oils quite frequently and try to use those almost exclusively. Occasionally, we'll need to use over-the-counter pain pill for a bad headache or something, or something like that. But
Yeah.
again, I try to stay as natural as possible.
It's like peppermint oil, right? It's pretty reasonable priced oil, and it's wonderful for headaches, right?
Yeah,
For
yeah.
just breathing, you can put in your showers.
Yes, so peppermint oil is great for
Mm-hmm.
headaches. It's great for digestive issues and upset stomachs.
Mm-hmm. Mm-hmm.
Um, the lemon is great for cleaning.
Mm-hmm.
It's very clarifying.
Mm-hmm. And there's you always think about it's aroma therapy. So the inhalation is as powerful and maybe even more so, right, than putting it on your skin.
Yes, yeah,
Mm-hmm.
and that's the beauty is even a small drop has so many individual molecules, and as soon as you breathe that in, it actually goes through your nose, through a little area called a cribriform plate, and directly into the brain.
Yeah.
So almost instantaneously, we start to get this biochemical reaction and the effects of whatever that oil is.
Mm-hmm. Mm-hmm. Yeah, so we can like put it in the little inhalers, like you see it now in a grocery, like in like these health food stores, those little kind of containers that you put in your nose and you can sniff it.
Yes,
Now you can actually create your own blend, right? And
yes,
for whatever you need. So like you said, when you inhale, it is like right away affecting your body.
yes.
Hmm.
Yeah, very
Yeah.
much so. You have to be careful with some of the essential oils with babies or with pets. But again, just a quick, simple internet search can give you a lot of that information.
Yes. Then you entered into the energy healing. And I know that you had been also interested in the sound healing as well. You had been trained in that. So how do you see, all these different modalities in your life? Just kind of like, what is your favorite? Would you go to like just personally? And just like, people want to know, like, what does doctor actually do now, having that kind of a background and now dabbing in this. So what is your favorite
Yes.
kind of a modalities you still kind of
I don't know if I have a single favorite, but I also want to thank you for telling me or that I need to go spend time with Norm Shealy out in
Yes.
Springfield, Missouri.
Yes.
Bless his
Yes.
soul.
Now let's just talk about that for a second because he passed away a couple years ago, but he deserves so much acknowledgement what he had brought to our wellness, to our medical, to all of that, right? I mean, can you speak on the medical aspect of what he had brought to for us to us in his
Yes.
lifetime?
So Norm was a absolutely beautiful soul.
Hmm.
And just when you first meet him, it's like he's kind of a quirky guy, but that's just Norm.
Yeah.
That's who he is. And he had no pretenses. But Norm was a neurosurgeon. He actually pioneered what we call the transsphenoidal hypophysectomy. So
Big
if
word.
you have a brain tumor in the hypophysis, which is right square in the middle of your brain, that there's no
Yeah.
easy way to get to it. And he was looking at an anatomy book and said, same thing like with the essential oils. If you go through the nose, it's right there.
Wow.
And all his colleagues said that's heresy. You're going to give him meningitis or infection of the brain and the spinal fluid, and everybody's going to die. Well, he finally talked to some patients and said, we can make this great big C-shaped scar in the top of your head, take a piece of your skull off, and go down between the two halves of your brain and get down to this thing, or we can just make a little opening and go through the nose.
Wow.
So he started that and pioneered that. Now that is standard of care to
Wow.
go that route. He
Mhm.
progresses on and was seeing so many people with back pain. And yes, back pain can be from a previous trauma, mechanical issues, and things like that. But a lot of times back pain without previous trauma, physical trauma, excuse me, can be emotional trauma, can show up in that area. So Norm, knowing how the body functions, developed the TENS unit,
Mhm.
which is the transcutaneous electrical stimulation that you put a couple pads above and below where that pain is, and you get low voltage current going through,
Mhm.
and it reduces the pain.
Mhm.
He then went to using a dorsal column stimulator. So it's an implantable type of a TENS unit where the probes actually go in the spinal cord or right near those nerves. And
Mhm.
when I met him in 2019, I said, Norm, you've got to be so proud of the TENS unit and the dorsal column stimulator. And he looked at me, goes, worst thing I've ever done. I was confused. I said, why do you say that? And he goes, Brian, because all we're doing is treating the symptom. We're not treating the underlying problem. We're just masking it. And until we get down to the core issue, it's always going to be there.
Yeah.
And that, again, is how I think we are trained in
And
allopathic
he couldn't
medicine.
take it back, correct? Because it was out of his hands at that point.
At that point,
Mhm.
yes. Yeah.
Yeah. And
So,
he also had created the bliss therapy, which is one of my favorite things.
yes.
Hmm.
So, which is so wonderful because it uses
Hmm.
specific blends of essential oils placed on different acupressure points in your body. And so using kind of the aromatherapy with traditional Chinese medicine and the meridians and acupressure points.
Hmm.
And I think there are 5 oils and 65 or 64 different points that you put those. And using those, you can do it within about 2 to 2.5 minutes every morning. So
Yes, and it also prolongs the strands on top of the DNA. It's the
yeah, the telomeres.
telomeres,
Yeah.
right? So that
Yes.
is, he was very, very proud of that. And what I liked about him is that he was not afraid to dabble into the unknown world of intuition. And he
Yes.
has been a big, huge fan of past life regression.
Yeah.
He believed that there's a lot of trauma that could be healed through going back in time, and he was definitely an individual that I was also blessed to be taught by. I would call him my mentor for sure. So with all of this knowledge that you have gained in your life, and again, we just scratching the surface, what are you now doing with your patients slash partners, like you like to call them?
Yes. My practice here in Indiana is called Aspire Plastic Surgery, and I didn't want to name it after me or anything like that because we all aspire for something. And whether it's looking better, but what I now know is if you look better, you feel better, and relationships get better, as we previously discussed. I've had this vision for about 12 or 15 years to open Aspire Health. And the grand plan was to start and have nutritional counselors and personal trainers work with a gym. And as the universe has it, one thing opens up and another one closes, and it just wasn't getting any traction. Um, and at that point, I thought, let's just concentrate on the energy healing. And that's where I'm going with this. We are now doing some energy sensing in the
Mhm.
office. The traditional way to do that is with pendulums, or if you're intuitive, there is a really cool device called a BioWell
Mm.
that you put each one of your 10 fingers in this individually, and within seconds, it shows the energy flowing through your body, how much energy is going through each of the 7 major chakras, if it's more introverted or extroverted, and then gives us a 7 or 8 minute tone with binaural beats specific to your results that day.
Oh,
So what we
wow.
will do is do the BioWell testing and then do a Reiki session, oftentimes with the crystals, aromatherapy, and some of these other things that we have, the
Mhm.
tuning forks that are tuned to the exact vibrational frequency of
Mhm.
each of the chakras.
Mhm.
So that's where what I'm trying to do with this is then start a coaching course, a one-on-one coaching course where it's modeled after my history, my
Mhm.
physical crisis that almost took my career away and was affecting everything that I was trying to do. And let's help people with the nutritional aspect, whether it's with the inflammation or if they want to lose a little bit of weight. And I have a series of 3 different botanical products that helps the body on that physical level.
Mhm.
But what I want to do then is help them to understand that it's more than that. It's the mental, the emotional, and that's where we get to decide. This controls the physical aspect, but this also reaches out to the universe, and we are all connected. One of the things that I start teaching in the 3rd degree Reiki or the Master Reiki is it's the pineal gland that helps us to connect with the universe, but also for us to televise our thoughts and our feelings and our emotions. But so many things that we do calcify that pineal gland.
Mhm.
So with this course, if people want to find out more about it, there's a quick 3-step thing that we can share. And if they just go to
Mhm.
gift dot aspirehealthcoaching.com, and it will send you a little link and get you just a 3 or 4 page outline of this 3-step process that I look for. And then if you want to go on from there, a short little video. And then what I'd love to do is to connect on a call and see where
Mhm.
these people are.
Mhm.
What is bothering them? What are the obstacles? What have they tried? And let's try things from a different level.
Mhm.
So, trying to get away from the allopathic method and using some of these other modalities to just help balance the body's energy sources.
Well, sounds to me like it's a great plan. And we will put that link on the bottom of the podcast once it's out so people can reach it more easily. But that's wonderful. So they have all these wonderful expertise that you put in it, including the chocolate, benefits of chocolate. So people don't have to necessarily feel like they're not getting the good stuff. So we'll just, before we wrap it up, is it anything you can share? Like you have advice for our listeners, something that would make them feel better, something simple, something powerful they can like carry on with them today. Like, is it any advice that you can share with us?
Yes, believe in yourself. We are so trained that and programmed that we need something outside of us. You need to do this, you need to do that. There's these social norms, all these other things, but you have everything in you already that you're ever going to need in this lifetime and the next.
Mm,
And we tend to downplay that. About 80 to 85% of the thoughts that we have are about ourselves, and
mm,
most of those are negative thoughts.
mm,
And just changing that simple mindset
mhm,
and accepting yourself and loving yourself
mhm.
because you are the being that God source created exactly the way you are.
Yeah.
And you don't need to please other people. You just need to have that peace in your heart.
Yeah, that's beautifully said. Thank you. So we'll end on this note. And can you please share with us again how people can reach you? You were saying Aspire. So is it aspire.com? Can you please let us know?
Yeah, so aspireplasticsurgery.com is
Mhm.
my plastic surgery practice. A direct email for me is Brian at aspirehealthcoaching.com. And then the one for this gift and the 3-step process is gift dot aspirehealthcoaching.com.
Wonderful. Well, thank you so much for finding your time and spending it with our listeners. And thank you for listening. And until then, have a wonderful and peaceful night.
Thank you, Lenka. Thank you for everything you've done for me. I greatly appreciate it, and you're one of my mentors.
Oh, Thank you, Brian. I really appreciate it.